pandemic. Each week, we've been honored to present speakers who help us report on these momentous times. On behalf of EMS, I want to extend a special thanks to Blue Shield of California Foundation and the California Healthcare Foundation for their support of this initiative. And also to veteran ethnic media reporters Pilar Marrero and Sunita Sarabji for coordinating these conferences. I've asked Jessica Martin to offer instructions on how to enter questions for the speakers in our chat box. We will be inviting questions for 4 or 5 minutes at the conclusion of each speaker, and we will end the conference with as much time left devoted to Q&A as we can possibly manage. So, Jessica.
The impact of COVID-19 on the elderly has been a consistent thread since we became aware of the pandemic. 8 out of 10 COVID deaths are of people aged 65 or older, according to data from the Centers for Disease Control. Today, our speakers will take a step back from the headlines and take a deeper dive into this really tragic phenomenon. I would like to start off with Dr. Nguyen, who has consistently provided us with an update on the pandemic. Dr. Nguyen, are you on the call?
Hi, everybody. Thanks for having me on again to give the regular update on the pandemic. As of yesterday, there are over 7.3 million people diagnosed with COVID-19 worldwide and over 400,000 deaths. In the US, we're now over 2 million infections and more than 113,000 deaths. Many of us are treating the pandemic less seriously than before. For example, the Trump administration has not held a COVID White House briefing for a month. And yet, the 200,000 new cases over the last 7 days in this country means that 10% of the total number of cases were just diagnosed in the last week. 21 states are having increasing number of infections. 14 states had their highest 7-day average of new cases last week. On June 10th, the United States had over 25,000 new cases, the highest number since May 21st. And on that same day, California had over 4,300 new cases, the most since the start of the pandemic. And Texas had over 4,100 new cases, twice more than the previous daily high. Reports from several states indicate that they are not attributing the rise only to the increased testing or the protests. Due to the increasing availability of tests, though, experts are recommending looking at 2 other metrics to assess whether the pandemic is worsening. One is the percent of positive tests, not just the absolute number. And the other is the number of hospitalizations for COVID. We know that the number of hospitalized patients for COVID has been increasing in the following states: Texas, North and South Carolina, California, Oregon, Arkansas, Mississippi, Utah, and Arizona. In Arizona, the report is that already 76% of the ICU beds are occupied. All of this suggests that there is certainly, at least in some states, a rising problem with the pandemic and possibly with the capacity of the state to handle the increasing number. A modeling paper just published this week showed that the widespread use of face masks can reduce the transmission rate, or the RE number, to below 1, which is a critical criterion for slowing down the epidemic. I and others think that the combination of relaxing the stay-at-home rules, an inadequate number of people wearing masks, or respecting social distancing are probable causes of the rise in the number of infections. On the treatment and vaccine front, a large randomized control trial showed no beneficial effect for hydroxychloroquine in patients with severe COVID-19. The results were so persuasive that the research team stopped the study early. So I think right now the available data suggests that hydroxychloroquine does not work for patients with mild symptoms or severe symptoms. I was asked to speak a little bit on the pandemic as far as the older adults are concerned. I think we all know that older adults are at higher risk of infection and deaths because actually both older age and other chronic health problems, which are actually more prevalent as people get older, are independent risk factors. One study a couple of months ago showed that the case fatality rate in the United States was less than 1% for those younger than age 54, but 3 to 11% for those age 65 to 84, and 10 to 27% for those older than 85. And as Sunita said, more than 80% of the deaths among adult patients occur in those age 65 or older. We also know, and I think some of our speakers will speak to this, that public health approaches like social distancing leads to isolation, which is more toxic for older adults who may need help with food, activities of daily living, as well as getting more elevated risk for mental health and cognitive problems associated with loneliness. I'll finish with nursing homes. It's been really the epicenter of the pandemic. Over 210,000 cases and 43,000 deaths have occurred in nursing homes or other long-term care facilities. As of May 28th, 26 states had at least 50% of their COVID deaths occurring in long-term care facilities. One study up until mid-May of over 9,000 nursing homes found that a third of the nursing homes had at least one COVID infection. And the factor associated with having a COVID infection were larger facility size, urban location, a greater percentage of African-American residents, and not being a part of a chain. I'll finish by saying that despite having months of warnings and infections, 1/5 of nursing homes still report they have less than 1 week of personal protective equipment or PPE left. Part of this has been attributed to delays in the delivery of the PPEs promised by the U.S. Department of Health and Human Services and FEMA. I'll finish my presentation there. Thank you very much.
The doctor just talked about two things in the opening part of his presentation about important factors to consider. And can you talk a little bit more about why tracking the number of positives or the percentage of positives is such a key thing to track?
Yeah, I mean, basically, the more tests you do, the more you would expect to have more positive tests because there are quite a few what we call asymptomatic patients out there, patients who would not even get to the healthcare system. So if you're just following the number of positive tests, the more tests you do, the higher that number is going to be. And it's not clear whether that's just picking up cases that you weren't picking up before. Whereas the percentage tells you if the percentage of positive tests goes up, that means there are actually more people getting infected.
Okay, Dr. Tung, I have questions that because right now the business already open. So what do you see on like a second wave that we're going to have more virus spread in the community? And what can we do about that? Yes.
Yeah, I think that either we're seeing a prolonged first wave or we're seeing the second wave as states and cities, counties are reopening. And I think it's really crucial. I mean, it's essential that we follow the ways that we know will prevent infection, and that includes at least 6 feet of distancing and wearing masks. I mean, right now, as far as individuals and business are concerned, that's what they have to do. I think the public health department needs to do a better job of more testing and more contact tracing, which is the other way of containing this. But as far as the rest of us, I'm really worried about the trend to not make mask wearing not mandatory because we already seen that in general, a lot of people don't wear their mask when it's not mandatory. And I think I reported last time that men are much more likely than women not to wear their mask when it's not mandatory. So we are going to have a second wave if people don't.
Yes, my question is, how much could increase the contagious if no masks, use face masks?
I'm sorry, can you repeat the question, please?
How much could increase the contagious, the coronavirus, for the people not use the mask?
I think if I understand correctly, if people don't wear masks, how much more will we have in terms of the infections and the pandemic? And the answer is that, again, we don't really know how to slow the pandemic down except with face masks and social distancing. Right now, there are no vaccines. So it's entirely possible that if we don't do a good job, we'll get the same problem that we had, 2 months ago with the pandemic. One of my colleagues said, the virus only cares about one thing, and that is to get into somebody and then get out to some other people. That's all the virus is doing. Nothing has changed. So we would expect that if we don't do the right ways to prevent it, it will continue to be infectious.
And our final question is from Fatme Bakit. She has a question about COVID-19 infection counts.
Yeah, hi doctor, how are you?
Good.
My question was, I received several articles talk about from the CDC admit that they screw up the COVID-19. They screw up the infection count, intentionally mislead the public, and have apologized for clarifying that amount of people truly infected is much lower than what was originally reported. What do you talk about that?
You know what? I would have to see what that is, because I've not heard anyone said that the number of infections are lower than report. Most of us think that the number of infections is actually much higher than reported, again, because we don't test people. So I'm not sure what that is. If you can send it to us, we'll take a look and see whether that's real or fake. The CDC has said that they have not done a good job of data collection and reporting, and part of that is their issue, but part of it's also state issue. So I think last week I mentioned that the Department of Health and Human Services issue some standard for reporting of COVID. Yeah, the answer is that we are undercounting, not overcounting.
Let me unmute myself. Okay. So is there a correlation with blood types, and how does this relate to higher infection rates in Latino and African American communities?
Yeah. Well, last week I reported that there was a study where the blood type gene is associated with COVID severity. I don't know that it was associated with infections. And right now, that's just one study. It's with these kind of research, you don't want to hang too much on a single study. And I don't actually, off the top of my head, know if there's a association of blood type A, which is the one that they found with African Americans and Latinx. I have to look that up, whether or not there's an over prevalence of blood type A in that population. I suspect that most of the things that we're seeing with African American and Latinx, however, is not due to genetics. It's probably due to much more to social and public health types of issues.
Dr. Nguyen, thank you so much for your constant presence on our calls. Enormously useful. We're going to move on to our next speaker, who is Dr. Charlene Harrington. She is a gerontologist and a professor of sociology and nursing at the University of California, San Francisco. Dr. Harrington will speak today about the impact of COVID-19 on the elderly population in nursing homes. Dr. Harrington?